Hey, it's Tabasco, the trucking biker, and this is part three of my digital anarchy series. If you haven't seen part one and part two, you have no idea what we're talking about because you're going to listen to a sophisticated biker talk about quantum biology. It's probably above your head anyway, so you might as well just scroll on. But disclaimer, I'm not suggesting that you do anything. In fact, if we're all following me, we're all in trouble. Uh, I wouldn't take advice from me. That's my advice to you about me. So, having said all of the fine print, let's move on to the conclusion where I expose a device that I use that you probably shouldn't buy. In fact, they don't want you to buy it. They don't even want you talking about it. So, nothing to see here. Keep it real. They view the mind as a side effect of the physical brain, and they focus on chemicals, not coherence. But quantum biology suggests life is a vibrational, coherent, and it's all connected. Health equals harmony, all levels of DNA, organs, awareness. Disease is a disruption in that harmony. Um, the alternate formula for health isn't just, surgery or pharmaceutical. It could include that as well as it should incorporate frequency retuning. That's what they're saying. And if you think that it's on the fringe of normality, then check out the Tesla med bed and see what that's about because um, the things that they know not aren't always shared. Not saying that you and I couldn't purchase a Tesla medbed if we owned a big giant, box store chain or whatever, and we had the enough commas and zeros, and the decimal point was far enough over in our income that we couldn't buy that. And then ask yourself, why are the those people using that? Why are they bombarding their body with frequency? And as well as, I don't quite understand the liquefaction of oxygen into the cell. I am not a scientist, believe it or not. But if the wealthy are doing it, and there's been seen results that they're going, they're actually looking like they're aging backwards. And it's not about that with the frequency. I don't know if that has to do with the oxygen stuff and some other things that I'm not going to discuss here. But part of it is the resonant frequency to the body. So I can tell you only this so far from my personal experience. Um, I told you the story about my friend and his mom, and so I purchased one here just recently. I should have probably purchased it sooner, but they're not tremendously expensive. And again, the RIFE digital period com. You can look at that. You don't have there's one that's is as much as like my first, well, probably my second car or something. But there's one that's relatively within reach of most people if they prioritize it. If you don't prioritize it, then that's fine. uh, but I did purchase one, and what happened, I think, after the age of 50 is a splinter takes 2 years to heal. I mean, things get worse than better often before they get better, and our body doesn't heal as quickly. So I took a slip and fall from the bed rail of my pickup truck probably 3 months, 4 months ago, and hell, I haven't slipped and fallen for ever. Last time I drank Mad Dog 2020, I think I was like 18. But well, that took a spill, and I landed in the back of the pickup truck in the bed with everything that was in there. Lucky I didn't cut my head off, but I injured my left shoulder, dislocated it, which has happened since I was 5 years old, and probably happened about 6 or 7 times in my lifetime. Once you pull one of those suckers out of a socket, they don't tend to ever, they fall out easier, and it hurts. And I forgot how wonderful that feels. But you can get past that. But what I couldn't get past was it wasn't healing. It was getting worse. And I'm not one to go to the doctor all that often because I'm such a picture of health. I didn't say good picture. And I will only give you this example that on my left shoulder, it was just irritating. And the fact that I'm doing freight and chaining and strapping and tarping and all that, it just can constantly irritate this thing. And it got to a point where I couldn't lift it above level. And I mean, without wincing in some sort of pain. Um, Hey, don't try me. I'll still whoop you, but I'd use my right hand. But anyway, I used it one. Finally, got around to using it after a couple of weeks. I used it one night on a specific setup, and I literally the next morning could lift it. Now it's not. Is it totally completely as good as it once as it ever was? No, probably not yet. But I haven't followed the pattern as I should to total healing of it, which is about 21 days. All I'm saying is if you had that technology available to you, or if you got it, you could probably not have to worry about, in some cases, and many maybe not. I don't know. Yes, no, maybe. Don't take advice from me, but maybe you wouldn't have to deal with that specific issue if your body was having a problem, because maybe you could have prevented it in the first place, or perhaps you could treat it and go away. There's one particular, which is that when I was 25 or 30, whatever, do the math, from the tattoo that leaves a everlasting scar on your blood cells. So if I use that and do it some lab work, and let's say I do it for the time frame that it says, and within 90, my friend believes, he goes, within 90 days you would not have any. He believes there would be no record of that ever having had affected in my body. That would be amazing, because again, that's another one that's not curable. So it can be in remission, but it's not curable. So stay tuned. We'll see. If I'm been running a total pattern. Basically, it's a convergence from 0.000.01 all the way to 999.99, back and forth, and a few days now. And I'm going to continue to try to do that. I'm not real good about taking the prescriptions either, even the antibiotics all through the end of the bottle. But I'm going to try to do that and see what the result is. And but I don't shoot the messenger. I'm just sharing what I know and what I've seen. And I have so many friends who haven't even heard of it and don't know about it. And again, everyone runs the mainstream science when they're in a panic mode, and I get it. I understand that. I'm not saying that we wouldn't either, but the likelihood of them fixing a problem is not much. In fact, I had a heart attack about, I don't know how many years ago, 2021. I supposedly will always be on this beta blocker and this whatever. I don't know. We'll see, because maybe I won't. That would be interesting, wouldn't it? If you retune the body. I don't know. Ask old Elon. He sells the med beds. What do I know? I'm just a truck and biker. Keep it real. And let me reiterate that I would never, ever give anyone any advice. My advice to you would be, don't ever take advice from me. And I would definitely not even, waste my time looking into things that, our government has us covered. No doubt. I mean, they will take care of you. So uh, keep it real.
I'm offended.